Beds are filling up quickly with COVID patients at University Hospital in Newark, New Jersey.
So we've doubled week on week in our hospitalizations, about 106 patients now in our hospital with COVID-19.
But what happens when the place you go to for emergency assistance is struggling to keep its own staff healthy and safe from infection? University Hospital's president and CEO, Dr. Sharif El-Nahal, estimates 6% of his total staff is currently out sick with COVID.
We had to bring in nursing students over the weekend to do some of these other jobs, and of course we're paying them. Medical students, they're coming in the next couple of days. So we are going to every single source possible for folks who have skills and can apply them to the patients that we're seeing.
University is not alone. Staffing is becoming an issue in hospitals across our region, including New York City. Mayor Eric Adams spent Wednesday afternoon at Elmhurst Hospital in Queens, one of the main hot zones during the early days of the pandemic.
We're all tired. I know that.
Adams announced the addition of 250 new employees for the city's Department of Health and a total of nearly $140 million in new funding for the city's public hospitals, as well as medical centers serving low-income communities.
We want to ensure that the proper staffing is there and the proper support is there. Pump up baseline staffing, including doctors, nurses, medical technicians, and support workers.
But as health officials in New York and New Jersey battle COVID inside our hospitals, there may be a crisis of confidence spreading out in the community. Longtime Newark resident and community activist Donna Jackson says many of the residents she meets are struggling to keep up with the never-ending flow of new updates and new information.
The misinformation, the no information, and the lack of trying to heal the community and give us the resources. There's a sense of not knowing. There's a sense of insecurity.
And we can expect to hear more from people on the front line. A registered nurse at Jacobi Hospital in the Bronx reached out to me today via email to tell me about a planned rally next week where nurses there are going to voice their concerns over staffing and other COVID-related issues.